We do have a shortage of different cadres of health workers. We have a shortage, but we do have the situation where our health professionals prefer to work in urban centres. So we do have negative skewing when it comes to the rural areas.
As part of the effort for improving evidence on health workforce for the SDGs, WHO has adopted as part of the global strategy what we call the National Health Workforce Account. This is trying to bring together in a systematic way the data and evidence related to health workforce. There will be better data and more data in terms of quality, but also in terms of availability and timeliness of data.
The Cochrane EPOC group focuses on interventions to strengthen health systems and improve professional practice and the organisation of care. For some time we've been concerned about how do we make the findings of our reviews more accessible to potential users. What's striking about the overviews is that they not only identify interventions for which we have robust evidence of their effectiveness, but have also identified important gaps in our knowledge about what works for health systems. And we're hoping that that will lead to governments and other agencies undertaking more robust evaluations of interventions in those areas so that we can build an evidence base.
This session that we've just concluded was part of this whole advocacy evidence generation. We are trying to promote together the use of evidence for decision making to inform policy making at the national and global level.
It's about helping potential policy users to access evidence about what works, but also to help them see where we don't actually know whether something works or not, so that better evaluations can be done in those areas. For me, what was striking in the area of governance is how little we know about some important interventions that are being quite widely promoted. I think many governments would like there to be greater accountability of health services to the public, including users of healthcare. We actually know very little about how to put that into practice on the ground.
One of the biggest challenges that we are facing in different countries, and in Africa in particular, is this mismatch between the evidence that exists and the use of evidence for decision making.
We found out that within the nursing profession, you need more of your enrolled nurses and your enrolled assistant nurses because they could be more cost effectively applied to do other tasks and to free up your professional nurses to do patient consultations, as an example.
Health is not only about the Ministry of Health, it's about the Ministry of Education for the training of the health workers. It's about Ministry of Finance for all the salary and retention incentives. It's about Ministry of Labour for all the regulations and all those are important, and we need to come together. Even if we manage to bring together different ministries to agree on concrete steps, that would be a big step forward.